This mini lecture is going to cover the mechanics of breathing. The term pulmonary ventilation refers to breathing, which consists of two different phases. The first is inhalation, also known as inspiration, and the second is exhalation, also called expiration. And before I can really explain what happens during breathing, it's best to first understand some of the different pressures that exist both inside and outside of the lungs. So, the respiratory pressures are always explained in relation to atmospheric pressure, which is the pressure of the air that is surrounding the outside of the body. So at sea level, just to give you an idea of what this pressure is typically like, at sea level, which is roughly where we are living in Delaware, atmospheric pressure is about 760 millimeters of mercury. And so you can see 760 right here. So that is the pressure in the air around us. And then there's two other important pressures. There's intrapulmonary pressure. That's the pressure inside of the lungs. Specifically, it's the pressure of the air inside of the alveoli, which are the sacs of air within your lungs. And when you are not actively inhaling or exhaling, then intrapulmonary pressure is the same as atmospheric pressure. They are equal. But during inhalation, this pressure drops below atmospheric pressure. And then during exhalation, it rises above atmospheric pressure. And the third pressure is called intrapleural pressure. And that refers to the pressure within the pleural cavity or pleural space. So this is the pressure that is here. It's outside of the lungs, but it's within the thoracic cavity. And this pressure is always kept at slightly less than intrapulmonary pressure. So here, just with this example that you're seeing on the PowerPoint slide, right now in this current situation that's pictured within the lung, so intrapulmonary pressure, the pressure is 760 millimeters of mercury. And remember, intrapleural pressure is always slightly less than that. So here it's 756, just a little bit less than intrapulmonary pressure. Okay, so now I can explain what happens during breathing. And this is the mechanics of breathing are determined by Boyles Law, which is one of the gas laws that states that the pressure of a gas in a closed container, there are two closed containers pictured here, is inversely proportional to the volume of the container. And this is as long as the temperature remains constant. So basically what this means is that if you have a larger or a greater volume, you will have lower pressure. So in this larger container that has a larger volume, the pressure is at 1. When you reduce the volume, so here there's less volume, that increases the pressure. You can see now the pressure is at a 2. So there's an opposite relationship between volume and pressure. When volume increases, pressure decreases. And the opposite is true. When volume decreases, pressure increases. So that law determines the movement of air in and out of the lungs. So during inhalation, I'm just going to explain some of the steps that occur to allow for inhalation. This is an active process, which means that it requires energy from the body. The body is actively contracting muscles like the diaphragm, which is a muscle that's located under the rib cage, and also intercostal muscles. So when this happens, when these muscles contract, the diaphragm, pictured here, the diaphragm moves down. You can see that from the arrow here. So when the diaphragm moves down, right above the diaphragm is the thoracic cavity. So if the diaphragm moves down, that is going to increase the size of the thoracic cavity. And the lungs are elastic, they are stretchy, so they will expand to fill that greater area. And that means that the volume within the lungs is going to increase. If they are expanding, then volume within the lungs increases. And remember what we just said, based on Boyles Law, when volume increases, pressure decreases. So now this intrapulmonary pressure decreases, and it now drops below atmospheric pressure. And there's one more thing that you need to remember, and that is that molecules always want to move from higher pressure to lower pressure. So air molecules that are outside of the body, they are now in a higher pressure area. Atmospheric pressure is now higher than intrapulmonary pressure. So air is going to diffuse into the lungs. It's going to move from higher pressure, which is in the air surrounding the body, to where there's lower pressure that is within the lungs. Okay, so air just diffuses in, and that is inhalation. So when air moves into the lungs, that's considered inhalation. So the other step is, or the other phase of ventilation is exhalation. And rather than being an active process, this is actually a passive process. It doesn't require any energy, and it just involves the relaxation of muscles. So now the muscles that originally contracted, they relax. So that would be the diaphragm, pictured here, and the intercostal muscles that are kind of in between the ribs. So when these muscles relax, the diaphragm moves up. And you can see that pictured here, and you can see the arrow indicating that the diaphragm moves up. So when that moves up, it causes the thoracic cavity to decrease in size. And because the lungs are within the thoracic cavity, they decrease in size as well. So they're composed of a lot of elastic fibers, and those elastic fibers just kind of recoil. Like if you can picture a rubber band, when it's stretched, it elongates. But if you let it go, it springs back to its original size. And that's what happens with the lung tissue. It's going to go back to its original size. It's going to get smaller. So that decreases the volume within the lungs. And remember, according to Boyles Law, when volume decreases, pressure increases. So now that intrapulmonary pressure increases, and it is above, it's higher than atmospheric pressure. So now we have higher pressure within the lungs and lower pressure in the atmosphere surrounding the body. And remember, air is always going to move from higher pressure to lower pressure. So if there's higher pressure in the lungs, air is going to diffuse out of the lungs and into the atmosphere where pressure is lower. And that is just done by simple diffusion. It does not require any energy. All right, so that's the basics of pulmonary ventilation.